for Allon4 zirconia prosthetics, when do we use titanium reinforcement? You guys can see the bottom of this prosthetic has that titanium bar there. So when do we use that? And can it stop a prosthetic that has an excessively long cantilever? Can it stop it from fracturing? And yes, zirconia teeth can fracture. So here's an example of a fractured zirconia from a patient that I had to remake it for. So let's talk about all this. So let's start simple. I want you guys to notice that there's 6 holes on this prosthetic set of teeth. This one has 4. So what are the holes? That's how many implants you have. So if you look here at this lower arch, this is a lower mandible. There's 6 implants that I placed, right? That's going to be synonymous with having the 6 holes. This one is an old school Allon4. And if you'll notice behind that last hole, which is where that last implant is, there is a long, what we call cantilever. And this isn't ideal for a lot of reasons, right? So you can imagine if you were chewing on your back teeth, right? And your prosthetic has a micro motion happening as you chew that you can't see, but it's happening. That is tough on the implants underneath this prosthetic, tough on the screws that keep your prosthetic teeth in place. So in an ideal world, when we have long cantilevers, we do one of 2 things. We either add an implant right here and right here, or we shorten the arch a little bit and we remove a tooth. So you guys can see in this situation, there's almost 1 less tooth in this arch. And we've shortened the cantilever. Now we only have about a 1-tooth cantilever. A 1-tooth cantilever is ideal. A 2-teeth cantilever is not ideal, right? So in a situation like this, right, where I didn't do this surgery, this was done many years ago, but I have to now fix, a fractured situation like this. I'll tell the patient, we can do additional implants. And in his case, he actually had a stroke recently, so that was off the table. We're not gonna introduce more stress to his heart. So in a situation where I know we have a very long cantilever and I don't want a situation like this happening, I'm going to add some titanium reinforcement. Prosthetic teeth are never cut and dry. There's a lot of different ways to do things, but in general, that's how I like to think about things. I like to keep it simple. And yeah, if you have any more questions, drop them below. Happy to answer.